At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our video and platform, please leave us a comment in the comment section below. What is trauma? Trauma is an emotional response to a distressing or disturbing event that often overwhelms an individual's ability to cope, causes feelings of helplessness, and diminishes their sense of self and their ability to feel a full range of emotions and experiences. It is not just the event itself that constitutes trauma, but a person's subjective experience of the event. The impact of trauma also extends far beyond the initial emotional response. It can manifest across various psychological, physical, and emotional symptoms that vary widely among individuals. Some people who experience trauma may have flashbacks, nightmares, and intrusive thoughts, while others might struggle with anxiety, depression, or a pervasive feeling of numbness. Types of trauma. Trauma is not a one-size-fits-all experience. It has many faces and can stem from many circumstances. Here are some types of trauma people could be facing. Acute trauma, chronic trauma, complex trauma, secondary or vicarious trauma, and developmental trauma. The trauma-informed approach is a transformative framework for healthcare practice designed to enhance both clinician understanding and patient well-being by acknowledging the pervasive impact of trauma. Having a trauma-informed model shifts the focus from traditional diagnostic models to a more holistic understanding of the individual's life experiences, particularly those involving trauma and their influence on current health and behavior. In practice, a trauma-informed approach transforms a simple question from "what's wrong with you?" to "what has happened to you?" Here's how this approach plays out in patient care. Listening. Active and compassionate listening provides a platform for individuals to share their stories on their own terms. Validating. Affirming that their emotions, reactions, and coping mechanisms are valid and understood within the context of their experiences. Adapting. Modifying treatment plans to acknowledge and respect past traumas and considering how these influence behaviors. Educating. Sharing information about the impacts of trauma and fostering a common language about resilience and recovery. Supporting. Building an environment that supports healing with relationships and structures that promote stability and consistency. The impact of trauma on a person's mental and emotional well-being can be profound, and the ripple effects can extend to every aspect of their life. To guide you through, here are some essential techniques of trauma therapy. Psychoeducation. Understanding is the first step towards healing. Psychoeducation involves equipping individuals with a clear understanding of the impact of trauma on their emotions and behaviors. Trauma-focused cognitive behavioral therapy. Trauma-focused cognitive behavioral therapy goes beyond traditional CBT by explicitly linking current emotional and behavioral difficulties to historical trauma, eye movement desensitization, and reprocessing. EMDR is a multi-pronged technique that has shown marked efficacy in trauma-related disorders. Somatic experiencing. Sometimes trauma is held not only in the mind but also in physical body. Somatic experiencing is a method that focuses on bodily sensation and aims to relieve the physiological impact of trauma. Mindfulness and relaxation techniques. Mindfulness and relaxation techniques like deep breathing, yoga, progressive muscle relaxation, and mindfulness meditation helps individuals anchor in the present moment. Resilience and strength building. At its heart, trauma-informed therapy is more about healing than hurting. It's about building resilience. Resilience and strength building involves identifying and enhancing personal strengths, resources, and coping skills. These are just a few examples of exercises and techniques. To learn more about trauma-informed intervention, go to our Carepatron website or click on the link in the description. We have a range of guides and articles to help you learn more about different therapy techniques to incorporate into your practice. Carepatron is a healthcare platform designed for you. Signing up is free, just click on the link in the description. If you enjoyed this video, don't forget to hit the like and subscribe button for more content like this.